So we're going to be talking about Module 12 today, which goes over age-related changes that can affect drug metabolism. The first that we're going to talk about is absorption. So think of this as the way that your body is taking in medications. Different routes, concentrations, and diseases are all things that can affect this. With routes, there are ways that drugs aren't affected very well, which are IM, sub-Q, PO, rectally. Not that they're not absorbed good, they're just not absorbed as efficiently as a drug that is administered via IV, orally, or inhaled. With concentration, anything that has a high solution or an increased solution or increased concentration, those are things that are absorbed faster. And you have diseases like diabetes and things like hypokalemia that can actually increase drug absorption. So those are definitely, if you have either one of those, you want to be monitoring what drugs you are taking, because you don't want to have a toxic level from having your body really absorbing something. Exercise can stimulate blood circulation, which therefore increases absorption. Another thing that can increase absorption is heat, so keep that in mind. The next thing that we're going to talk about is distribution. Changes in circulation, membrane permeability, body temperature, and tissue structure are all things that modify distribution. It's important to know that if you're taking any type of medication that is highly protein bound, you want to monitor your albumin levels. With albumin, if you have a low albumin level, you're opening up all those receptors that would normally either bind to a protein or bind to a drug. So if you have a low albumin and you're taking a drug that is highly protein bound, now you're at an increased risk for toxicity, which is not a good thing, okay? So you always want to keep your protein up, you always want to stay hydrated. The next thing that we're going to talk about is metabolism, ways that can decrease metabolism of drugs. Again, we don't want this, but dehydration, hyperthermia, immobility, and liver disease. So those are all things that decrease metabolism of drugs. Another thing that can decrease metabolism is if you have a reduced secretion of enzymes. What this does is there are certain drugs that need that enzymatic activity. So if that's not there, the metabolism is going to be decreased. With excretion, age-related changes, the kidneys are just slower functioning. They're not functioning as well as they used to. So your body is not going to excrete those drugs as well. So fun little fact is that drugs actually stay in your body longer. So if you have the half-life of a medication, it is actually increased by 40% just because your kidneys aren't working as well as they used to. Another thing about your kidneys is that the glomerular filtration rate, so the rate that it's processing everything, is decreased. So again, your drugs aren't going to be excreted as fast as back when you're in your 20s. Another thing in your body that kind of slows down with age is your liver. Your liver is another organ that's responsible for filtrating out your medications that you take in. So there are just some fun facts for you about things that can affect your drug metabolism. Okay.